BC, visioned and directed by the Ministry of Health, the patient medical home is being recognized as the foundation on which to build a streamlined and accessible service to patients. The patient medical home is a family practice defined as the place patients feel most comfortable to discuss their personal and health concerns. The most responsible provider, usually the family doctor, but sometimes a nurse practitioner, works collaboratively with a team of health professionals, either within or linked with the practice, to deliver longitudinal, comprehensive, and coordinated care of patients. The 4 goals is to increase access to appropriate, comprehensive, quality primary health care for each community, improve support for patients, particularly to vulnerable patients, contribute to building a more effective, efficient, and sustainable healthcare system in order to increase capacity and meet the future patient needs, retain and attract family doctors and teams to work together in healthy and vibrant work environments. The enablers are in technology, education, evaluation, and supports, plus 12 service attributes. In Ridge Meadows, this is an opportunity to redesign healthcare together with physicians, our health authority partners, and our community stakeholders. The Ridge Meadows Division of Family Practice and our community's patient medical home strategic vision is to provide the best patient coordinated care in our community. We are starting with data collection, working in partnership with PSP to understand each physician's patient panel. Over the next year, we will then collect that data and start to understand the patients and their needs. We will then start to formulate like-minded patient panel needs and create what's called physician networks. It could be a network with diabetes, it could be a network with adult mental health, it could be a network of frail elderly, it could be a network of child and youth substance use. We will find those like-minded patient panels and develop those physician networks. The physician network intent is to then bring together the physicians that have majority patient needs. We'll bring together the health authorities, community services, patients, allied health professionals, and we'll start working towards redesigning care for those populations as a community. This data for each physician will also provide them in a readiness position for when the Ministry of Health does provide allied health services to the community. The physicians will be in a position to apply for those services for their clinics. We will also work with this data and this learning for a community plan that will work for Maple Ridge and Pitt Meadows. And we'll all be on the same page when it comes to providing best patient care. We also are seeking funding to support specific vulnerable populations that the physicians have identified as a priority. Adult mental health, chronic pain, child and youth mental health substance use, specifically through the Youth Wellness Center, and frail elderly. If we provide funding through Share Care, those will also be significant patient medical home models that will improve patient care in our community. We'll also be seeking funding through Share Care to take our relationships with the specialists in the community, the specialists in the hospital, the physicians in the hospital, the physicians in the community, to take our relationship from good to great. The physicians have identified they would like technology to access each other quickly, to work for best patient care. They would like to create space for efficient face-to-face time. We feel by supporting this relationship, this will also in turn support the success of the patient medical home. The patient medical home will have strong governance for decision making as well as direction. We will have a steering committee that will be co-chaired with Dr. Ursula Layton that will involve physicians, specialists, the hospital, MCFD, Fraser Health, public health, nonprofits from the CN network, patients, and local government. Working groups and focus groups such as evaluation and physician networks and other focus groups deemed necessary will report up to the steering committee. The steering committee will then report up to the CSC committee and then up to the board and strategic advisory committee for the division, along with Fraser Health. The initiatives for chronic pain, adult mental health, youth wellness center, the specialist and GP engagement work, and for elderly will also feed into the CSC and board, along work in partnership with the steering committee. We will also continue to communicate and engage with the community at large and GPs and specialists through our strong member engagement events, as well as with communications.